Do you have issues with thin lips? Well, in our society, plump, pouty lips are definitely looked on as a youthful feature. But unfortunately, as we get older, our lips definitely lose volume and they get thinner. Well, the great thing is that there are a number of options for you to get those lips back and to plump them up. Okay, so let's go over first how we look at lips. Because the one thing that we don't want and that we've all seen in Hollywood are celebrities who've got overly plumped up lips. And they don't look natural, they look stiff, they look weird, and people even call it a trout pout or duck lips. So, what are the normal proportions of a lip? Well, the lower lip should ideally be about 50% thicker than the upper lip. So, if you look at this picture to your left, you can see a younger woman with nice full lips. These are the normal lip proportions, where that lower lip is about 50% thicker than the upper lip. However, as we get older, and like you see above in this picture here, that's a lip, those are a pair of lips that have gotten quite a bit thinner with age, where it's hard to even see what the proportions are, okay? And so this is very common as we get older, where those proportions decrease. Now, where people go wrong is when they plump the lips up, they overly plump up the upper lip, and you get those proportions off. And sometimes I'll even see that the upper lip looks bigger than the lower lip, and that's why people look like they have duck lips or the quote-unquote trout pout. So what you want to do is, if you are considering refilling up your lips and plumping your lips up, you want to keep those normal proportions. That lower lip should be 50% thicker than the upper lip. And my injector specialists here at YPS are all knowledgeable about these natural lip proportions. So the easiest way to plump up the lips are to do it in the office. And we use injectable fillers. And typically these are all hyaluronic acid fillers. I don't recommend any non-hyaluronic acid fillers for the lips. The ones that we use most commonly are starred there, Juvederm Ultra and Ultra Plus. It's a nice filler for the lips, lasts anywhere from 6 to 12 months. It's nice and soft, injects real smoothly, and we use that very commonly in the lips. Another option is Restylane Silk, and this is a Restylane product that's a little bit thinner than the traditional Restylane, but has good longevity, around 6 months, sometimes longer. That also can be used for some of the vertical lip lines as well that we typically don't use Juvederm for. Restylane Define and Refine are also great options for the lips. I would use Define to help plump the lips up. Refine could be great for some of the fine lines around the lips as well. That lasts upwards of up to a year. Regular Restylane is something that we occasionally will use on the lips. It used to be the gold standard until some of the newer ones have come around, but that's, I think, a reasonable option as well. Once again, I don't recommend non-hyaluronic acid fillers in the lips. I don't recommend Sculptra in the lips. Definitely don't recommend Radiesse or injectable silicone. Not good idea. So stick with the hyaluronic acid fillers. How we do the treatment, pretty straightforward. You come in, you fill out the paperwork, and then at that point, typically, we'll give you an ice pack to numb your lips up, okay? Also, we can apply some numbing cream to the lips as well. Now, the majority of time, we combine using a cannula with a needle to inject the filler. And so what I typically do, and I've trained my injector specialist to do the same thing, is we will typically make a tiny little poke in the corner of the mouth, then use a cannula, which is a long, blunt needle that kind of glides under the surface to inject that filler, okay? Then we'll make a little poke in the upper corners of the mouth and inject with the cannula, the upper lip, and then we switch the needle to inject that Cupid's bow, which is this part of your lip up here, to keep that nice and kind of curved as naturally as it is. By using a cannula, it's typically a bit less painful for most patients. Some patients disagree, but in general, I think it's less painful. You have less swelling and less bruising because you have less injections of it. And I do think overall you can get a smoother result with a cannula. And most importantly, there's a lower risk of the accidental injection of that filler into a blood vessel. That's the big risk with injection of any filler, is injecting into a blood vessel. And using a cannula, that risk is definitely lower. After the procedure, you'll put some ice over the lips. It will look a bit swollen. Now, the lips swell up more than any other part of our face. And that's why if somebody gets popped in the face, they never end up with a swollen jaw or a swollen cheek. It's always their lips. They get the lips puffy. And so the lips will swell up very quickly, but the great thing about lips is you ice them up for a while, and that swelling does typically come down very quickly too. So you put some ice on your lips, you may have a little bruising, definitely a little bit of swelling. That swelling typically, even within an hour or two of leaving the office, will come down. I've had patients who've had their lips injected. They walk out the door of the office going, oh my gosh, what did I do? My lips look way too big. And then they call us an hour later. They say, it's perfect. The swelling has come down. So very common. Don't be afraid if you have it injected. If you feel like the lips are a little puffy initially, most likely that's just due to swelling. Let me show you an example of a photo here of somebody who's had Juvederm Ultra to the lips. And you can see a real nice change. Those natural lip proportions in this patient are retained and they look naturally good. We have other photographs both at the office as well as on the website if you want to look at other people who've had their lips plumped up. So the most common choice to plump up the lips is an injectable filler. You know what you're going to get. You can see it. By using a cannula, it can be done very safely and effectively in the office. The goal is to keep those natural lip proportions. Well, what if you are looking for a longer lasting result? Well, we do have the option of fat. When we inject fat, we take fat from the tummy or the thighs, purify it, make a little nick incision each corner of the mouth, and then inject it into the lips. This is typically done under a general anesthetic, so you're completely asleep. The procedure takes all of a half hour, 45 minutes, and that's it. There's no stitches typically involved, but initially your lips look big. They look puffy because not only is there a good amount of fat injected into them, but they swell up a lot. As far as the recovery, there's very little pain with it. Your lips are going to feel a bit tight. They're going to feel plumped up, and they're not going to move quite as naturally for a little while because they're so plump. But usually you give it about 2 to 3 weeks, and the vast majority of the swelling is gone. At about 6 to 8 weeks, you'll see pretty much what you're going to see long term. The negative about fat grafting to the lips, and the reason why this is not my top choice and we go more with the fillers, is that a good percentage of that fat that we inject into the lips will go away. Upwards of 80 to 90% of the fat that we inject will disappear. Okay, that's a lot of fat that goes away. Because of that, I really overcorrect the lips, knowing that almost all of that fat's going to go away. But because I overcorrect it so much, things are quite puffy afterwards. Okay, and I will inject anywhere from 1 to 4 cc's of fat into each upper or lower lip. You compare that to the average patient who has 1 syringe or 1 cc total when you combine the upper and lower lip, and those lips are quite big with fat grafting initially. And then almost all of it goes away. But what does stay will stay long term and can stay 5, 10 years, even longer. Okay, so for those of you, if you're undergoing another surgery, like let's say a facelift, and you always wanted big lips, by all means, let's do the fat, because whatever sticks around, sticks around. You're going to be recovering from the other surgery anyway. But if you're just in the office and you're working and you don't want to take time off, fat grafting is probably not the best option because you will look quite puffy for a while. Best just to do a filler, because then you're going to have much less downtime than you would with fat grafting. Here's a couple of examples of what are very nice but pretty subtle changes with the fat grafting. Okay, you can see with this patient, a bit of an older patient, very, very thin lips starting out. I injected, if I remember right, 3 cc's of fat into each upper and lower lip, and a nice change, but still fairly modest. So if you've got issues with thin lips, start off considering the filler. If you're looking for a more permanent result, fat grafting can definitely do that for you, but it takes a bit longer. You may have to have more than one treatment. Thank you for watching.